Thanks for joining us. Let's start with vaccinations and COVID. More than 80% of Seattle residents above the age of 12 have had at least one shot. I think you were the first city to do it. 71% of all residents have had both. To what do you attribute that success?
You know, it is a combination of things, Michael. First is, we were the first into the pandemic, and we had no federal leadership, no guidebook. And so we learned early on we had to rely on some really key things. Number one is we had to listen to science. Number two is we had to have leaders on the same page so that the public knew very clearly what was expected of them and be very transparent as to why. And then to really rely on scientists and researchers as to what did we need to do to fight this virus. I know we're going to talk about testing. That was one of the first big things. But building on that, I was able on a weekly basis, I had a group of advisors, both national and local advisors, telling me what to worry about next and how to basically overcome COVID. And it was critical that vaccinations were going to be key to us reopening as a city, not just our economy, but our schools and coming together again. And so we had a very all of government focus on how did we build out and get vaccinations to everybody who could. So we had both mass vaccination sites and local sites, and we worked very closely with communities of color to make sure that we did vaccinations equitably.
The team that told you what to worry about next, Mayor Durkan, what are they telling you about the variants now? How do you keep your eye on those, and what has it meant in terms of your plan?
Yeah, I think that the variants are, as we've seen both globally and nationally, the variants are on the rise, and particularly the Delta variant right now. It is particularly worrisome for those people who are unvaccinated. And still here in Washington State, and even more so nationally, our communities of color are lagging. If you look at hospitalization rates, the people who are vaccinated are much less likely to be hospitalized or get sick. So looking at the variants, we're really worried about what that will do to people who aren't vaccinated, including children. We don't know yet, 12 and under, kind of what the impacts of COVID will be. And so people bringing home that disease to their families. So really looking, how do we continue to increase vaccinations? And then the next thing we all have to be thinking about is a booster, which I'm sure no one wants to be thinking about, is the next series of shots we have to get.